So the exercises that I would have this patient do early on is initially I would have him do some stretching and strengthening of the wrist. And so this will help him get back to that level where he's able to support those tendons with other structures so that they're not having undue stress on them, and he'll be able to put his wrist into more mechanically suitable positions than where he has been in his overuse positions. And I would not want to do these if there was any like acute inflammation or any fractures or any excess pain with any of the motions. I would have the patient stop because we're not trying to further aggregate the tendons and make anything worse. And so for stretching, what I would have my patient do is I would have him place his hand out in front of him, and I will have him actively go into wrist flexion as far as he can. And once he gets to the point where that is no longer painful and having no issues with that, I can provide a passive force just to push it a little bit further. And then I can do that in each direction. I can have him do it in extension. Same thing, once he's at the point where there's no pain any longer, I can just provide that passive force. Ulnar deviation and radial deviation. Radial deviation, same thing. Ulnar deviation, the same thing. And then for strengthening, I would give my patient a TheraBand. And you can hold this with your opposite hand. And so what I will have him do is make it nice and taut and resist it from the motion he wants to do. And so for wrist flexion, I will just have him slowly go into flexion. I will have you, can I have you hold the band downward? There you go. And now up into flexion. And then slowly back down. And then the same thing for extension, except switch the position of the band so that it's up towards you. And then up into extension, and then back down. And same with radial and ulnar deviation. Hold it out to the side opposite of where you want to go, and then radial and ulnar deviation.